Running a dialysis centre can be a lucrative business. Treatment can cost anything between 2,500 and 3,000 rand per session. Patients are required to do their treatment several times a week. The cost can spike to up to 100,000 rand a month. Many South Africans have no access to dialysis in the public sector. Currently, it's the few on medical aids that push up the demand for dialysis. But the South African Nephrology Society is concerned about the lack of regulation.
The units that have opened around the country, I think it's in response to a demand. And certainly, if you're going for dialysis and the typical patient needs it for like 4 hours, 3 times a week, the best place for you to go is the place which is closest to your home and the most convenient. So it makes sense for units to be opening up in places where there's a demand, where people need it, where they don't have to travel far from their home. And I think that's the right thing that should happen. The problem is in South Africa we don't have in place yet proper regulations which governs the monitoring of these units and the basic standards which have to be set.
Bianca Koch and Matthews Lwabile spotted this business opportunity about more than 5 years ago. Today, the two run 5 successful dialysis centres across the country.
There are things to be considered. For example, you have to look at the legal requirements. One has to register the same company that the dialysis unit you are opening needs to be registered, and you need to have a practice number. And also you need to purchase machines or equipments. You look at equipments like a dialysis machine. You have to buy things like therapeutic chairs, emergency trolleys, and so forth and so forth. And not only that, there are some equipments that needs to be installed. For example, a reverse osmosis machine, which is used for purifying the water. It's the heart of the dialysis unit.
To establish a medium-sized dialysis centre, the equipment alone can cost up to 3 million rand. The most important devices to operate a dialysis centre include dialyzers and water treatment systems. The machines allow blood to be pumped out of the patient's body to an artificial kidney machine and returned to the body by tubes that connect the patient to the machine. Bianca Koch, a qualified clinical technologist, says most of all their patients are on medical aid insurance.
We got together, me and Matthews Lwabile, our renal trained registered nurse, and we united because we had a common goal of making a significant difference in the lives of patients with a kidney journey. How we decided to do that was to provide end-to-end renal dialysis facilities where patients will get hope restored while being on this journey. And also for their loved ones, hope is restored. We had a goal of getting a dialysis footprint throughout South Africa, and it's steadily materializing.
For Dumisani Kalimba, being on dialysis is not easy, but he's long accepted this reality.
The improvement I see is I live longer because I follow the directions that they tell me by the doctor and the nurses. I must not skip the medication, and I must not skip the dates or sessions of coming to dialyze.
Lifestyle diseases are the main root causes of renal failure. South Africans are urged to eat healthy and exercise regularly.
Diseases such as diabetes, hypertension, those are the diseases that may result in a patient having a kidney disease, especially if you are not controlling them well. So controlling them means you have to take your medication and you have to eat healthy. But if you continue eating those foods that are high in salt, that are high in fat, unhealthy fats, so you end up being experiencing such lifestyle diseases.
The absence of proper regulations of dialysis units in South Africa means that many South Africans using these treatment facilities could still be at risk.